At the Conference for Machine Intelligence in Medical Imaging 2020, Nvidia researchers presented a paper giving insight into how a medically savvy language model can be applied to improve physician productivity and patient experiences.
Welcome back to Sonic Insights.
Background and how it works. Advances in natural language processing, or NLP, have led to architectures such as BERT that relies on unsupervised pre-training to develop sophisticated language models. Most of the success with this have been around general domain applications, usually leaning on sources like Wikipedia, as the framework requires extremely large volumes of training data. The hypothesis Nvidia had was that a language model that was pre-trained on a large biomedical text dataset would outperform the generalist dataset model. In the research, they proved just what they set out to do. The large BERT-based architecture, pre-trained on the 4.5 billion words of biomedical text, outperformed the generalist domain dataset. However, it did not stop here. They also trained an even larger BERT model called Biomegatron, which is 6.1 billion words of text. That even larger BERT model outperformed the smaller but still biomedical domain-specific dataset. Experience and value proposition. This research was inspired by the rise in telemedicine as a result of the COVID-19 pandemic. If you can imagine a doctor appointment, whether this is telemedicine or in person, there is ultimately a lot of conversation that not only needs to be analyzed and diagnosed in real time, but also needs to be recorded for patients' historical records. And this task has ultimately been noted in the past, even before the COVID-19 pandemic, to be a key driver of physician burnout. The Nvidia research plays into this experience in two different ways. As patients talk about their symptoms, the voice AI can capture, recognize, understand, and summarize key concepts and structures, such as disease conditions, symptoms, and treatments. This allows doctors to better serve their patients in real time with real-time information based on the conversation that they are having. The efficiency is not only in this face-to-face patient experience, but also provides other efficiencies for the doctors. These models can easily be integrated to automate charting for both telemedicine and in-person visits, which overall improves physician productivity.
For an efficient way to stay up to date with audio, voice, and hearable technology, subscribe to our newsletter, podcast, and YouTube by checking us out at sonicinsights.co.